you have to show some of the points on our head region, okay,
Right.
which are the most important ones, and show us how to stimulate. And then after 5 points, we'll ask somebody else to do it. Okay. So
Okay.
you can
Yes,
start
sir.
the first 5 points.
Yes, sir. So the first point is Tilartha column, which is between the eyebrows. And you have to keep the pads of your fingers on that point. And to stimulate, you have to just push it upwards, keep it there for some time, and then pull it down very slowly without any pressure. Like you have to feel the pulse over there and then push it upwards and down. The second is Tilartha column 2, which is 1.5 fingers above the Tilartha column 1.
Padmaji, don't go fast. Like, give everybody some time to actually practice along with you. Okay.
Okay,
Think
okay.
like a practice class, not just an explanation class.
Okay, yeah. So the importance of this point is that it controls the 10 vayus in your body. So this is, and also Sir has told us that kalam, when the word kalam comes in that particular marma, then it's very important. So you just have to push it upwards along with the skin, not just the finger, and then down. Once more.
Padmaji, not down, not down, not down. We don't
Okay.
push downwards. Or just lift and release.
Oh,
Lift
okay.
and release. No.
Okay, lift and release. Okay. Now the second Tilartha column 2 is 1.5 fingers above the 1. And the same, you have to stimulate it the same way. Push it upwards, keep it there for some time, and release. Okay. Push it upwards and release. And you need to check that when you're inhaling and exhaling, your exhalation has to be longer than your inhalation. Upwards and release. Now the next point is the Brahma Marma, which is 4 fingers. When you start 4 fingers from your eyebrows, it comes on the hairline in the center. Go along the center of the face on the hairline. There is a Brahma Marma. And this Marma is useful for all the brain issues. And the way to stimulate it is to just zigzag motion, you know. So not just the fingers, but along with the skin, you have to slowly do the zigzag motion. Okay. Now the next point is again a Brahma Marma, the second one. So you have to keep 3 fingers from the first Brahma Marma, and you will find a kind of depression over there. And that's the second one. Stimulation way is same, zigzag motion, very lightly with the pads of your fingers, and you have to use 3 fingers. If possible, you can close your eyes while doing it. Now the next one is the Adhipati Marma, which is right on the top. So there are 2 ways you can actually locate this Marma. First way is to along, from your top of the ears, you just have to go upwards. And when you come to the center, that is the way. The second one is 7 fingers from your hairline. That's how you find the Adhipati Marma. So it's also known as the Vishnu Marma, and in acupuncture it's known as million dollar point. Because when you compress the body completely, this is one point where it will come to. So this is, you can say, the controller of the whole body. So if you want to treat the whole body, this is the point you need to treat. Again, zigzag motion along this point. Now the next one is the Mahesh Marma, which is 3 fingers behind the Vishnu Marma. Again, you'll find a depression over there. And the stimulation is same way, zigzag motion. Now
Have you
this is the
practiced it?
controller of the hormones.
Do everybody practice ताकि आपको याद हो जाए. This is how Padma ji is explaining is very nice. I'm really, finding no words how she is explaining everything. तो
Thank
आप
you, sir.
लोग तो आप लोग हर कोई कीजिए ताकि, क्योंकि मैंने देखा है बाकी सारे जो क्लासेस है सब लोग भूल जा रहे हैं. ठीक है, they don't remember.
Right.
तो आपको remember you have to always keep practicing.
The next one is the Karuna Mitra Marma. I'll show it on my hand because I won't be able to turn backwards. So for example, if this is the skull, can you see it? Okay. Now, if you move your head up and down, okay. Now, under the skull, imagine a line going down on the cervical and 2 points here to the right and 2 points to the left. So this is just 1 centimeter from each other. And the way to stimulate it is with your thumbs. You just have to keep it like this and just move your head slightly upwards and downwards. Mild pressure on those points. And you can move your thumbs like this if you want to. Now, this is the master controller. It's of the body. Upper 2 points handles your upper body and lower 2 points stimulate your lower body. So you can just mildly, keep your fingers like this, go out and down. Up. Yeah. Now the next one is 2 fingers above your, if this is top of your ear, okay? 2 fingers above it. So this is the fire element, you can say, and I'm not remembering. This is Chunambu Kalam. Is that right, sir?
Yes.
Yeah, Chunambu Kalam. And the stimulation way is same with 3 fingers, zigzag motion. So if you have high BP, this is the point which you can stimulate to balance it. This is fire element.
Okay.
The next one, okay.
We'll now move to Morgan ji.
Okay, thanks, sir.
Yeah. Okay.
Okay. All right. Namaskaram, everyone. Well, I'm going to take you through the points around the ears. Okay. So, ma'am has already taken you through the Chunamba Kalam. Next point is called Poigai Kalam. Okay. Poigai Kalam, I'll tell you exactly where to find it. It's just close to the attachment of the ear, where the ears are attached. Just a point near that. You have to just keep your middle finger, okay, and just make a circular motion.
No, Morgan ji.
Okay.
Lift.
You have to lift it. You have to
lift and
you have
then
to lift it. Hold it. Lift it. Take 3 circular motions. 1, 2, and 3.
Okay, Morgan ji, can you show us turn and show the exactly how you're moving?
Yeah. See the middle finger? It comes to the ear part, the attachment exactly where it ends here. It's getting attached here. All right. Lift it up. 1, 2, and 3.
Okay. So I want to make a point here before you move to the next one. So what it is happening? See, when you place the finger, okay, and want to move it, don't make a big circle like this. Circle has to be very small, only here.
Very small.
Okay, the radius of that movement should be very, like you are doing a stimulation, like say on the Chibok Marma or say Kapol Nash.
Yeah.
Here only. Yeah. So we'll don't make it a big circle.
Yeah. Right. The circular motion has to be such that nobody should know,
yes,
how much is the motion. Yeah. And it so when it comes to elements, it belongs to the air element, and it helps for the lower back and liver and gallbladder. Yeah, it helps you to
Hmm.
activate that part. So, and also if you do it clockwise, it cleanses. It's for cleaning. Okay, and if you do it the anti-clockwise, you're giving energy. But if the anti-clockwise is required only if the energy, if the energy is okay, then you don't have to give it. Only the cleaning part is fine. Yeah, we just do the clockwise. All right. So that's the Poigai column. The next part I'll take you is the Shanka Marma. What is Shanka Marma? Okay. Now when you go, I'll have to remove my Bluetooth. Okay. So now there's something called triggers. Triggers is the middle part of the year where you have this kind of a wave. Okay. Hold your thumb there and take it to the outer part of the eye, which is also called Nakshatra Marma. I'll take you through that later. Okay. And bring it to the center. When you bring it to the center, you'll get a point there. Again, you'll have to do circular motion with your middle finger. That's called the Shanka Marma. And this is actually a general therapy. You can give it for anything, both side rotation. And it's also the control of the earth element.
Again, the circle is little big. Try to just make it a little
Yeah,
more
try to
small.
make it small.
So say
Yeah.
if I'm doing, I'll stay here only.
Yeah.
Oh yeah, I think a little bit of voice is breaking down, but it's fine. We can adjust for one day. The
Okay.
network is not always the technical. This is the technical problem we have to face.
Absolutely. So are you able to hear me or not, sir?
Yeah, we can hear. We can hear it. Next one.
Okay. Okay. All right. So this is Shankamarma is done. Okay. Next, we take you to Apangamarma. I make an X here. We get a point here. That's called the Apangamarma. Okay. It's just crossing over the outer corner of the eyebrow. Basically, that's the junction point here. You just have to make a gentle and less force you have to put. All right. And this basically
Again,
helps.
smaller. Morganji,
Yeah,
make
small,
it very,
small
very small, like a very
so that,
gentle.
people
Yes.
can see it, making a little bigger rotation so that people can see. Yeah.
Nice. Oh.
And it's like ether and sky element. It controls the ether and sky element. So basically, it helps for the large intestine. Okay, issues with the lungs and large
for
intestine.
this one, Apang Marma, there is a special technique. First, we have to press with the thumb 3 circular motion, then push backwards. Like Poigai column, we lift, then rotate. Here we rotate and push back. Rotate and push backwards towards the ear. Rotate and push back towards the ear. Okay?
Yeah.
Rotate and push back towards the ear. Okay, next one. Are you there, Morganji?
Okay. Next comes the Vidur.
The network is now.
Next point is called the Vidur Marma. Now, how do you find this? Take your thumb, take both your thumb, take it to the joint. I mean, the ear part, the end of the ear and the jaw, the meeting point. So you have to just keep your thumbs, both the thumbs, and lift it up. This is called the Vidur Marma. So mostly it's a controller of water element, good for your kidney and urinary bladder related issues. Yeah, just lift it up.
Okay, so we will now move to the next one.
I think you should get a pain. When you touch that point, you will get a pain. Slight pain will be there. Just lift it up.
Okay. Okay, Markanji, thank
Should
you
I go
so
through
much.
the ears? Yep.
Okay, so for now,
Thank you.
today will be fine. We will move to the next one. Mrityunjayji, are you there? Can you show us something? Just a minute. Can you open your mic? No, we can't hear you. The voice is not coming, Mrityunjayji.
So probably you have to give.
I am not prepared that, sir.
Yeah.
Sorry.
Now it is coming. Now it is coming.
Sir, I am not prepared that. Only two
Not
persons' name are telling yesterday.
okay.
Yesterday,
Sadhika ji,
like,
will you be able to do it? Few more.
So can I do if you want to do the year part, I can do the year part if you want.
Okay, but
I
I know.
have my notebook in front of me. I haven't learned all the mamas. I have my notebook in front of me.
Acha,
So I just can explain, but I
Hey.
haven't learned that.
who has remembered? Anybody who can comfortably say few more points in order? Okay, तो कल से मैं दूसरा मेथड यूज करूंगा. So you have to learn everybody and I will ask randomly. ठीक है? सबको प्रैक्टिस करना. ठीक है? So
Yeah.
I'll not tell the name today. Randomly you have to go, but sorry, in order all the points close to the ear and then move to the next points in our face. Anybody who is very comfortable in explaining? Okay. So fine. So आप लोग
year points.
हाँ. तो आप लोग जैसे अभी नेक्स्ट क्लास में फुल सारे पॉइंट्स फेस के और हाथ के से कंप्लीटली रिमेम्बर करके आओगे एंड आई विल गो रैंडमली. ठीक है? सिर्फ 5 6 पॉइंट विल डिस्कस एवरीवन एंड so today we'll finish on the remaining points of the legs.
Oh, legs you're going to do.
We have few more points left on our legs. Now the 2 points I'm going to discuss now on the legs are already discussed on the hands, we discussed before, which is Indrabasti 1 and Indrabasti 2. So 4 finger from the center of your knee, 1, 2, 3, 4 is Indrabasti 1, 5, 6, 7, 8, Indrabasti 2. So anybody remember what is this meant for? Indrabasti. Indrabasti, which is good for? Which is good for all urinary bladder issues.
Urinary bladder.
Okay, bladder issues. So including the UTI related, UTI जैसे infections के लिए भी आप इसका use कर सकते हैं. See, so this is like what you can call it. Urinary bladder is the responsible for water metabolism. Okay, water metabolism. So that means if you are holding extra water in the body, that is because of the hypofunctioning of the urinary bladder. The urinary bladder is holding the water and it is because the energy is too high. So in some way, if we can decrease the or sedate this urinary bladder, then the extra water from the body will go away. And this extra water which is in our body has many reasons. I'll tell you, I'll give you some examples why this is happening. So few things I have been noticing in my experience that the body likes to balance. Okay, like if your body is too heated up from inside, there is too much heat in the body. Okay, then generally the body likes to hold a lot of water. Okay, so it will hold water to balance, and you will see that generally people who are digestion is not good or tends to get weight very fast, their left nostril is mostly open. They will see the Ira Nari is mostly active. Okay, the Pingla is not functioning very well. Okay, the people generally who are very digestion, the reverse is also true. ठीक है, तो ये इन कॉन्टेक्स्ट में आपको थोड़ा ये देखना है कि आपका बॉडी कैसे फंक्शन कर रहा है. ठीक है, so body will try to adjust. So if your body is tends to get weight very faster, तो आपको नोटिस करना है कि कहीं आपका बॉडी में एक्सेसिव हीट तो पैदा नहीं है हो रहा है. ठीक है, तो इस बात को आपको चेक करना है. और इसीलिए बोला जाता है कि जैसे कॉपर बॉटल से पानी पीना. ठीक है, that is very very good because it balances all the doshas, including it brings the calm coolness inside the body. ठीक है, क्योंकि बहुत एक्सेसिव हीट की वजह से हमारा बॉडी our body tends to gain more weight. तो इसलिए आपका वाटर मेटाबॉलिज्म जो है बहुत इंपॉर्टेंट फैक्टर है. जो लोग मैंने काफी वेट लॉस पे काफी काम किया है, और मैंने एक चीज नोटिस किया है कि लाइक इन द बिगिनिंग when you are say fasting or doing proper diet, you lose a lot of water only from the body. This is not the fat, this is the excessive water which you are actually losing in the beginning itself. Okay, so so they say कि every gram of carbohydrate which you are eating, every gram, it holds 3 gram of water in the body. If you are eating 1 gram of carbohydrate, it will hold 3 gram of water in the body. तो आपका अगर कार्बोहाइड्रेट का कंजम्पशन बहुत ज्यादा है, which is obvious in our Indian diet, but it was say designed in a particular way because Indians were supposed to work in the field or face very tough climatic situations, very hot, extreme heat. But वो तो अभी सबके लिए सेम नहीं है. We are working in the office, we have very easy lifestyle and we have too much we can consume. तो इसी के वजह से अगर इसके बाद भी अगर हम even if you see people who are living in the villages, okay, they have also getting into a lifestyle where they are not probably physically working anymore. Okay, even they have a lens for agriculture, they are giving it to others and they're sitting and just enjoying, because this is how the lifestyle has become. तो आप अगर फिजिकल एक्टिविटी नहीं कर रहे हो तो आपको कार्बोहाइड्रेट की बहुत जरूरत नहीं है. तो that is why you have to make sure all these things stays in your mind when you choose your food, and it has to be a very conscious choice. Okay, तो वाटर मेटाबॉलिज्म को इंद्र बस्ती बहुत अच्छे से हैंडल कर सकता है. Let's move to the next point, which is
Sir, I think I'm not able to see that figure that you're showing. Is it only with me? Problem with me?
no.
He's not shown any figure yet.
अच्छा अच्छा, okay okay.
नहीं, हमने दिखाया था.
Me neither. I cannot see anything.
हमको आप ही दिख रहे
Only
हैं सर.
sir. Yes. Only.
Oh,
Yeah, we could only see you only, sir. So far.
Okay.
Yes, we can't see.
I think this the net it has
Lag
cut
is
down.
okay.
Gone.
There's a lag, sir, in between. Yeah, from your end, there's a lag.
Just a minute. अभी दिख रहा है? अभी
Yes sir, now we
Okay.
can see.
Yeah, now we can see.
तो इंद्रबस्ती का लोकेशन जैसे हमने पहले देखा था, एल्बो के नीचे है. तो यहाँ पे भी आपके नी के नीचे 4 finger down we have first Indrabasti, then 8 finger down we have the second Indrabasti. Indrabasti 1 and 2. Urinary bladder, UTI infection, and then water metabolism. Okay. Then we have The ani and urvi, that is also we have learned. 1, 2, 3, 4. 4 finger up is the ani, then 8 finger up is urvi. Iska, the ani which is in the leg, okay, it has another name in the Siddha system, which is Bir Veera. Veer Arangal. मतलब ये एक इमरजेंसी पॉइंट है फिर से लोअर बॉडी इश्यूज के लिए. बीर अरंगल इमरजेंसी पॉइंट. ये जो सारे पॉइंट्स है, ये सारे पॉइंट्स आपको प्रेस रिलीज के मेथड से ही आपको स्टिमुलेट करना होता है. ओके, हमने जानू मर्मा के बारे में सीखा था कब? Have we covered the जानू मर्मा? No.
No, sir.
ओके. अभी पैर में जो ये पॉइंट देखोगे आप, ओके,
Only foot area covered.
ठीक है. This is my back of the knee, exactly in the middle of my knee. Okay, this is a point called bladder 40 or UB40. ये जो पॉइंट है in acupuncture, this is in according to acupuncture system. This point is a very important point of the urinary bladder channel, and it can treat almost any problem in the urinary bladder channel, means especially the lower back pain. So if you see blue or green color veins in this area, okay, which is very common in women above 50, you know that there could be she might have the lower back pain. Okay, so what we do in an acupuncture, we directly bleed from this particular veins, and the back pain can be cured very, very fast. Okay, so this marma point is called janu marma. Janu का मतलब संस्कृत में नी होता है, तो janu marma. But this is not the only one. There are 3 janu marmas. So one is this one, obviously. Another one is 2 finger below, but on the corner or the side of the leg. And here the another one. So this triangle is very, very important area for your lower back pain. It is definitely working on the knee. For अगर हमने देखा है, मैंने काफी बार फायर कपिंग करके नी पेन को काफी ज्यादा रिलीव किया जा सकता है इस एरिया पे. ठीक है, आप बहुत ज्यादा अच्छे से इसको प्रेस करोगे, प्रेस रिलीज मेथड से करोगे, बट आपको यहाँ पे 3 उंगली से प्रेस करना है, ना कि थंब से सिर्फ. इस जगह में आपको तीन उंगली से आपको प्रेस करना होता है, ना कि 1 उंगली से. सो दिस एरिया वेयर आपको अगर ब्लू और ग्रीन कलर वेन्स दिखे, तो आपको जानना है कि यूवी चैनल में काफी ज्यादा प्रॉब्लम है और आपको ट्रीट करना है इस एरिया को. सो दिस इज जानू मर्मा 1, 2 and 3. Now we'll come on the inner side of the legs. Now from the knee joint, if we measure 12 fingers, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So at 12, we have a point which is, we say, Ulthadai Marma. ULTHA, Ulthadai Marma. So this is one more point to release the dopamine hormone. ठीक है, तो इसको आप स्ट्रेस, एंजाइटी, fear, lack of focus, then depression. ये सारे ऐसे इश्यूज में आप उल्थडाई मर्मा को यूज कर सकते हैं। तो उल्थडाई मर्मा को टैप करके, सिंपली बाय टैपिंग कैन डू, और यूज द थिनर मसल, मतलब हाथ की जो ये मसल है हाथ का, इससे आप सर्कुलर रोटेशन आप करके इस एरिया को स्टिमुलेट कर सकते हैं। अभी will come,
Not with your fingers, right, sir? Not
no,
with the fingers.
not with the fingers, of the
Okay.
this area of your
Palm. Palm. Okay.
clockwise rotation. Now we'll come to the front of the knee. Again, this is the front, and we'll measure 13 fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. 13 fingers. Amai column. इस मर्मा पॉइंट का काफी ज्यादा यूज योगा में होता है। क्या आप बता पाएंगे कि योगा में कौन से ऐसा प्रैक्टिस है जो इस पॉइंट का काफी ज्यादा यूज होता है इसमें? हमारी कॉलम
पद्मासन सर।
हाँ जी, वेरी गुड, पद्मासन। जब आप पद्मासन करते हो तो अमाई कॉलम का स्टिमुलेशन होता है, और ये जो पॉइंट है आपका आपके, बिकॉज इट इज इन द स्टमक चैनल, ये जो येलो डॉट्स आप दिख रहे हैं, ये येलो डॉट्स स्टमक चैनल को रिप्रेजेंट करता है। तो आपके पैनक्रिया के जूस को, पैनक्रियाटिक जूस को इम्प्रूव करेगा और आपके डाइजेशन को बढ़ाएगा। तो इसलिए आप देखोगे कि जो लोग पद्मासन करते हैं वो कभी, दे विल नेवर गेन वेट। और ये डायबिटीज का सबसे इंपॉर्टेंट पॉइंट है, ठीक है। जो जिसको भी डायबिटीज है उनको पद्मासन आप हर दिन करने के लिए बोलेंगे, हर दिन। और जितना प्रैक्टिस करेंगे, प्रैक्टिस करते करते करते, जब इसी पॉइंट के ऊपर आपका प्रेशर आएगा बैक ऑफ द फुट का, तो ये धीरे धीरे उस पॉइंट को तो स्टिमुलेट करेगा ही करेगा और डायबिटीज को भी क्योर करेगा। तो इफ यू आर मेकिंग अ प्रोटोकॉल फॉर द weight loss and diabetes, then definitely include this point. Never forget this point. And this finishes all the points of our legs as well. Okay, now let's discuss a protocol to enhance the immunity, because the winter is coming and we need very good immunity against the cold, okay, and relief from the cold and cough. तो आप मुझे 10 पॉइंट बताइए जो कोल्ड कफ इम्यूनिटी को बढ़ाने में मुझे मदद करेंगे। कोल्ड कफ एंड immunity. Point number 1. Please start. Everybody, please participate and tell me which are the points I should include here on this protocol?
They're on the wrist,
on the-
but
On the
Nahin.
wrist part, sir, you showed us three
From the beginning,
points.
from the head to feet, whatever you have learned till now. In the preferential order,
the
we will
first
definitely
Tilartha
we will
column.
will definitely एक करके
करना
सबसे
पड़ेगा।
नहीं, सिर्फ आपको बताना नहीं है, आपको एक्सप्लेनेशन देना है। Why कपोल नासा? Why कपोल नासा? बताइए। बताइए बताइए, अब क्या हुआ? अभी बताना है। अब सब चुप हो गए। कैसे होता है वो जानना है हमें।
So the adogandha you're talking.
Tell us the reason. Even if it is urdhagandha, why urdhagandha?
Because of see urdhagandha, it controls the girikarna vayu.
हाँ,
Okay. And it controls all the joints as
कोल्ड
well.
कफ इम्यूनिटी
So-
के लिए हमारा कौन सा ऑर्गन को हमें ट्रीट करना होता है? कौन सा ऑर्गन को हमें पावर देना होता है? Which organ? Which organ?
No.
Lungs.
Place.
Lungs.
Lungs.
Lungs. Tell the marmas which are related to lungs. That's it. And
Yeah.
what? So there is one more side effect side also. For your immunity, your stomach should be also very good. Okay, your digestive
Clean.
power has to be very good. Okay, that is also very
So-
important.
So the marma point is apanga marma that relates to the lungs. Apanga marma.
I will still say think in a preferential order. सबसे पहला पॉइंट आप कौन सा याद करेंगे? सबसे पहला और सबसे पावरफुल?
अधिपति मर्मा।
Adipati.
नहीं, और बताइए, और सोचिए।
Sir, Tilartha column, sir,
Why?
because it controls all the vayus.
And
And it is column, it's very important. So it's like the whole body.
शायद मैंने
kind of,
इस
yeah.
चीज को मैंने शायद नहीं बताया है, लेकिन तिलार्थ कालम मर्मा is directly connected to the lungs. ठीक है?
Okay.
Okay.
Directly connected to the lungs in a way that if you in acupuncture, this is called the extra point. Okay, this is not comes under any channel, so we call it an extra point. And this point, when we do moxibustion का मतलब एक हीट थेरेपी होता है जिसमें हम एक पर्टिकुलर हर्ब को, ठीक है, and that herb is called moxa. Okay, and that is the cousin of the Indian weed. तो उसमें जो आपका जो क्या बोलते हैं, जो it doesn't have any addictive substance, but the smell is very similar. Okay, तो वो इस चीज का काफी ज्यादा इस्तेमाल चाइना में होता था बहुत पहले से, और इसको एक पैरेलल सिस्टम के हिसाब से देखा गया है। निडलिंग के पैरेलल सिस्टम मतलब जहां पे वो लोग बोलते हैं कि जहां पे निडलिंग काम नहीं कर रहा है, आप उस जगह पे मॉक्सिबशन करो। ठीक है, जहां पे नीडलिंग काम नहीं कर रहा है और आपको बहुत क्लियर है कि दिस इज द पॉइंट व्हिच इट शुड वर्क, यू हैव टू डू मॉक्सिबशन। बट मॉक्सिबशन बिकॉज इट्स अ हीट थेरेपी, इट्स अ यंग थेरेपी, तो आप ऐसे कंडीशंस पे ही यूज करोगे जहां पे द यंग इज डिक्रीजिंग, द यंग इज वीक। ठीक है, अगर हाई यंग कंडीशंस में, जैसे हाई बीपी कंडीशंस में आपको यूज नहीं करना होता है। ठीक है, हाइपर एक्टिव किड्स में मोक्सा का यूज नहीं करना है। तो जब कोल्ड कफ एस्थमा जैसे सिचुएशंस में तिलार्थ काला मर्मा पे अगर हम मॉक्सिबेशन करेंगे, हीट देंगे, तो ये काफी ज्यादा अच्छा होता है लंग्स के लिए। ठीक है, तो इस पॉइंट को हमें भूलना नहीं है। तिलार्थ कालम शुड बी इन प्रेफरेंशियल ऑर्डर, द मोस्ट इंपॉर्टेंट टू ट्रीट योर लंग्स एंड इम्यूनिटी। नेक्स्ट इज द अपांग मर्मा।
Yeah.
Okay.
So I'm sorry if I can just ask you a question on that Tilartha kalam. You said to give heat. So
Yes.
with that moxie, something said. What exactly is that? So I didn't understand. How do we give that heat?
So it is in form of a cigarette. but it's a very thick cigarette. Let me
Okay.
see if I have.
Oh.
Let me see. Just give me a minute.
Yeah, sure. Thank you, sir.
I don't have a full one, but this is a burnt one. Okay, so this is how it exactly looks like, and it will be like this big.
Okay.
So you have to burn it and just apply it here. Hold it close to the point. Okay. So you will get that, get this in the Amazon itself. And I really want to show all these things to you before we end the class, because it will give you a very good impact. The other method which you can use is this, which is we call massage potli. So it's a massage potli where different kinds of herbs and spices are available, and you have to roast it for 5 minutes and just apply it here. Okay, so this also gives a very calming effect on your lungs area. एस्थमा के पेशेंट्स के लिए आप इसका काफी ज्यादा इस्तेमाल कर सकते हो, उनको बहुत अच्छा फील होता है, बहुत जल्दी ही उनको रिलीफ मिल जाता है, मतलब within few minutes they get relief. Okay, what next point we want to include to treat the lungs, to improve the condition of our lungs? Come on, quickly. ओके, कपोल नास के बारे में हम एक चीज बताएंगे. कपोल नास है एंटीहिस्टामिन पॉइंट. एनीबॉडी नो व्हाट इज हिस्टामिन?
Yes, sir, it is released. It's an allergy thing.
हाँ बताइए, अच्छे से बताइए और अच्छे से बताइए.
So if someone has allergy of pollen grains, and if that person goes in the area where there are lots of pollen grains, then the histamine is released by the brain to I mean, you start sneezing and runny nose. So
what exactly happens? What exactly happens when this hormone is released? What is anatomically what is happening? Anatomically or physiologically?
Sneezing. Sneezing.
हाँ, sneezing तो होता है, that is the effect. But what anatomical change it can create? It generally constricts the air pathways.
Yeah.
Okay,
because they think that it's a danger for the body.
It's a danger.
Right.
So it creates it
It
constricts
sends
the
a
air.
message to the brain.
Exactly.
Yeah.
It sends a message to the brain that you have to react this way. It's a reaction to that pollen
Right.
from our body.
So if you are in an area now, cold and cough, everybody will be sneezing, and a little bit of pathogen outside, and if the body can sense it, it will make the same thing will happen, and you will start feeling आपको गले में जो खराश होती है ना पहले फीवर से पहले, ठीक है? So it could be the effect of the histamine itself. ठीक है? तो कपोल नाश जो है एक एंटाहिस्टामिन पॉइंट है, ठीक है? तो and this histamine is also responsible for the asthma patients, because asthma patients में क्या होता है कि though there is nothing, okay, but the histamine production is very high, so it is a autoimmune condition in autoimmune condition, ठीक है? एस्थमा, बिकॉज यहाँ पे इम्यूनिटी को सप्रेस किया जाता है हिस्टामिन के द्वारा, थिंकिंग दैट देयर इज डेंजर एंड बॉडी सिक्रेट्स ओवर हिस्टामिन. तो कपोल नाश एक एंटी हिस्टामिन पॉइंट है, तो हिस्टामिन का प्रोडक्शन को कंट्रोल करता है, जिससे आपको ऐसे अगर आपका गला बंद हो रहा है, you're not able to breathe properly, your noses are blocked and the sinuses are like blocked, then it could create immediate relief to this particular problem. Kapol nash. Don't forget, this is just placing here and
with the little finger and
yes.
So I used to take antihistamine cetirizine tablets for all these things. Now I'll use this Kapol nash.
और आपका मैंने अभी हजारों रुपए बचा दिए, देखो, ठीक है?
Thank you.
हाँ, तो ये आप this is a miracle point. Again, in ears, our ears also, there are few very powerful antihistamine points जिसका हम यूज करके asthmatic patients को long term relief दे सकते हैं. So in very old days, just behind the tragus, आप जो बोल रहे थे ना, the tragus के पीछे, अगर tragus, if I divide the tragus of my ear in 3 equal parts, just imagine, okay, just imagine 3 equal parts में अगर हमने divide किया, जो third portion है, नीचे वाला portion है, उसको अगर हमने जला दिया, if we burn that area little bit, just like a pinpoint burn, then it will create permanent solution to your asthma. Okay, asthma will never happen again. So this method was used by many people who, like the local shamans in the olden days. Okay, तो एक एंटीहिस्टामिन पॉइंट है ट्रैगस के पीछे. ठीक है, और बताइए which more points we can use. Cold cough immunity. बताइए fast, quick, everybody. So many people.
Urdhagandha.
Urdhagandha we have discussed. Urdhagandha we will definitely use because it's a local point for the nose, and if only the noses are blocked, then we can use the Urdhagandha. Nose blockage. Kakshadhara, very good. Kakshadhara. Kakshadhar because it is lung 1. ये point बहुत जरूरी है. और बताइए. This is 1, 2, 3, 4, 5, 6. Quickly. We have just few minutes left. Kaksha Marma, no. We can find more points which are directly related to the lungs.
Sir, Chunambu Kalam.
No. Chunambu Kalam is related to heart. Heart and the brain. Direct connection बनाइए और थोड़ा. What about Chabbu Marma? Very important one. सब भूल गए इसको. Chabbu Marma. The oxygen point. O2 point. Yes or no? Chabbu Marma, not Chambu. Chabbu. 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 Yes. Anything else? 7.
Karnapal.
Karnapal. Why?
For fever purpose.
Karnapal. Yes. Karnapal. Fever. Yes. Very good. Karnapal. और
Nasaput.
Nasaput is mainly a pain releasing point or a point for menstrual disorders. तो हम इसका इस्तेमाल अभी नहीं करेंगे. Ani directly relates to the lungs. Ani. More. Few more.
Urdhagandha.
Urdhagandha we have discussed.
Manibandha.
No, why Manigandha? There is no connection as such very clearly. Is there any?
Kapha.
Kafanari Marma. Kafanari Marma.
Chibuk Marma.
Why?
Digestion.
डाइजेशन के लिए हम बेटर है हम अमाई कालम को यूज करें. अगर डाइजेशन से रिलेटेड है तो आप इसका यूज कर सकते हैं. ठीक है, लक्ष्मी मर्मा का भी यूज कर सकते हैं बिकॉज लक्ष्मी मर्मा इज वेरी क्लोज टू द साइनस एरिया. ठीक है, So stimulating the stomach, it will not only impact the sinuses, but it will also impact the stomach channel, because Lakshmi Marma is also coming in the stomach channel. Lakshmi Marma has also one more Siddha name, and that is Bal Murti, Bal Murti Kalam. Okay, Lakshmi Marma. Val Murti Kalam. Lakshmi Marma.
So, is it written? Are you writing it somewhere, sir? Because we can't see the writing. What do you?
I just wrote just on the chest area. You can see Lakshmi Marma, Balamurti Kalam.
Oh yeah. Sorry.
Yeah.
Okay, so from the things we have learned, any questions as of now? From the things we have learned already.
Sir, I have a question. So is it a good practice to stimulate all these marmas every day, maybe just for a few seconds?
आपका जैसे ओवरऑल स्टिमुलेशन दिया जाता है, ठीक है, ओवरऑल स्टिमुलेशन डेफिनेटली दिया जाता है, सारे पॉइंट्स को आप एक्टिवेट थोड़ा बहुत कर सकते हो। इन द इनिशियल डेज आप याद रखने के लिए एक मतलब 2 सेशन में 2 टाइम डिवाइड कर सकते हो, ठीक है। मॉर्निंग में से 5-10 मिनट्स ऑफ प्रैक्टिस, इवनिंग 5-10 मिनट्स ऑफ प्रैक्टिस, because if you want to make it a professional practice, obviously there are some practices needed, and this is the subtle, it's very, very subtle compared to any other subjects like auricular or there are subtle aspects of it, but marma is the most difficult one because you have to actually feel it. You have to feel it by your touch. Okay, that is why it is tough. But the results, when you start practicing on others, you will see with just simple touch how people start feeling so nice and so good. Okay, तो आप उस चीज को मतलब ज्यादा मत सोचिए, आप सिर्फ अपने प्रैक्टिस को इम्प्रूव करने में फोकस कीजिए, थोड़ा थोड़ा करके, कंसिडरिंग दैट यू आर अ बिगिनर, और आपको मतलब वो अवेयरनेस होना जरूरी है कि कहीं कुछ गलत ना कर दे या ओवर ना करे या स्ट्रेस ना ले मन में, एटलीस्ट नो स्ट्रेस व्हेन यू आर डूइंग, कि हमें करना ही है तो हम एक ही साथ में कैसे याद रहेगा, क्या कितना टाइम हो रहा है। तो आप जैसे आपके पास टाइम नहीं है और आप जबरदस्ती बैठ के जल्दी 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 करने की कोशिश करें तो उसका फायदा नहीं है। तो 5-10 मिनट्स उसको डिवाइड कर ले ताकि टाइम का एटलीस्ट प्रॉब्लम ना हो। Okay, any question, anybody have any more questions?
Sir, after practicing, after doing some marmas, I'm feeling a little feverish. So is that normal or?
हाँ, आप हमेशा जो फेवरिश होना बहुत मतलब गुड साइन है। फेवरिश होना या यूरिनेशन जाना या तो टॉयलेट जाना या वॉमिटिंग सेंसेशन आना, ये सारे बहुत ही अच्छा माना जाता है, बिकॉज कि आपके अंदर जो कचरा है वो बाहर निकल रहा है और इट इज कमिंग इन फॉर्म ऑफ ऑल दिस थिंग्स। ओके, सो ऑल दी नॉन required things are coming on the surface level because of this practicing marma. So this is why this is very, very good. But when you end the session, always stimulate the kutri marma. Always stimulate the kutri marma at the end of your session. Stimulate the kutri marma. Okay, self practice के समय kutri marma is the over the tragus of the ear. उसको stimulate करने के बाद ही आप अपने practice को खत्म करोगे। ठीक है? Okay. Any more questions?
Thank you, sir.
Okay. तो आप लोग जैसे जो सर्टिफिकेशन के लिए अप्लाई करना चाहेंगे, मुझे पहले से इन्फॉर्म करके रखना, ठीक है, सो दैट आई कैन ट्रैक योर अटेंडेंस। बाद में आप बोलोगे कि सर मैंने तो कर लिया है या नहीं किया और टाइम चाहिए, एंड सो आप बाद में बोलोगे तो मुझे थोड़ा सा मुश्किल होता है, क्योंकि प्रोसेस को कंप्लीट करने में मुझे थोड़ा टाइम लगेगा। ठीक है, क्योंकि लॉन्ग थिंग्स, देयर आर लॉट ऑफ थिंग्स व्हिच यू हैव टू डू। आपको आपका जो फोटोग्राफ्स है, फिर सर्टिफिकेट्स है, कुछ डॉक्यूमेंट्स है जो कलेक्ट करना है और उसको सही से पहुंचाना है, फिर एग्जाम के लिए वो सारी चीजें भेजना है हमें, फिर एग्जाम विल हैपन, then wait for everything, and then the certificate will come to you to your house, so we have to make sure the address is correct, so all these things will take a time। ठीक है, so आपको मुझे पहले ही इन्फॉर्म करना है कि आप लोग अभी तक आपने जो सीखा है that is good enough for you to understand whether this is worth investing for or not। ओके, तो इसको देख के आप थोड़ा डिसीजन ले सकते हैं, 1-2 दिन और वेट कर लीजिए अगर मन है, लेकिन आप लोग सोच सकते हैं कि आपने 50% अभी तक सीख लिया है ऑलरेडी, बहुत ही कम और बाकी है। ठीक है, तो 1 हफ्ते के अंदर आपका शायद 1-2 हफ्ते के अंदर, 2 हफ्ता भी नहीं लगेगा, उसके अंदर खत्म हो जाएगा, एंड देन यू कैन स्टार्ट प्रैक्टिसिंग। एंड इफ एनी डाउट्स, ऑब्वियसली आई एम गोना keep helping you in your practice, that is for very sure। Okay,
So what's
Okay.
the process for examination, sir? How does the examination happen?
so exam paper will come, it will be the multiple choice question and answer. You have to just fill it up and share within the time. That's it, there's no complication as such। Okay,
Okay. It's online. Okay.
yeah, it's an online thing only।
Okay.
Okay, so we'll stop it here for today. Let's stimulate the Adhipati Marma. Keep your fingertips on the Adhipati Marma. Take few long deep breathing. Now join your hands to the prayer mudra. Thank you so much, everyone. Good night. Take care, and we'll see you on Monday again.
Good night.
Monday, is it? Tomorrow, Friday?
No, tomorrow there'll be no class because I'll be busy in opening my clinic. Tomorrow I'm starting my clinic, so all of your blessings will be needed. This is I'm
Congrats.
doing.
Good
Congrats.
wishes, sir.
Best of
Yes.
luck, sir.
Thank you so much. Thank you.
All
the best. Wish
Thank
you
you.
all the best.
You
All
are
the
teaching
best,
very well,
sir.
sir, and you are
Thank you.
successful in your.
Congratulations।
Thank you।
Happy Diwali, everyone.
Happy Diwali as well.
Diwali.
So आप लोगों को
Happy
क्लासेस
Diwali.
करना है मंडे से, because
Oh, yeah.
दिवाली का छुट्टी चाहिए सबको। क्या करना?
Tuesday,
Diwali, sir,
Tuesday
how
would
would
be
you-
better.
Hmm?
Tuesday
Yeah.
would
Tuesday?
be better.
Tuesday, maybe.
Yeah.
Wednesday. So even Monday,
Thursday would
Tuesday,
be-
both the days, in Bombay, it's a big thing, all the Diwali celebrations are
So
happening.
Wednesday would be better.
Yeah.
Wednesday.
तो आप लोग ग्रुप
Wednesday-
में जैसे एक अपना प्रेफरेंसेस
Yeah.
आप शेयर कर दीजिए,
Yes. Yes.
so that we can see
Yes, we will
what
put it in the
everybody has
message.
to say, and then we'll take a
Yeah,
decision. Okay,
Oh,
great.
Sure,
Thank
sir.
you.
Thank you.
Thank you,
Good night,
sir.
sir.
Good night.
Have a nice
Good night.
Good night.
So, BJ